in Africa: Egypt, Algeria, and Nigeria. There is ongoing community transmission mainly in 5 countries: China, Korea, Japan, Italy, and Iran. Advice for Nigerians: we should all remain calm and avoid panic at this time. Everyone is to regularly and thoroughly wash hands with soap or use alcohol-based sanitizer to disinfect your hands. Maintain 1 meter distance between yourself and anyone who is coughing or sneezing. This is called social distancing. Make sure you and the people around you follow good respiratory hygiene, which means covering your mouth and your nose with a handkerchief or tissue when you cough or sneeze, or if you do not have any of those immediately at hand, coughing or sneezing into your bent elbow. Immediately dispose of the used tissue after use. If you are feeling unwell with symptoms such as fever, cough, difficulty in breathing, stay at home. Call NCDC toll-free. The number is available 24/7. 0800 97 000. This number continues to 0102 to 010. Do not indulge in trying to treat yourself. If you are not better after a few days, call at a hospital. Stay informed on the latest development about COVID-19 through official channels, including Lagos State Ministry of Health, NCDC, and of course, Federal Ministry of Health, Media Department. We shall now take questions from the ladies and gentlemen.
One quick one, sir. My name is Fred from the Sun. Honorable Minister, 2014 we had Ebola and it came from soya. But up till now, the identity of this particular guy, pardon my ignorance, has not been disclosed. We want that, if possible. Then second one is before the arrival of coronavirus, certain amount was released according to you. We want to know how that money has been used. And now we have the virus is around us. What is the financial need or request you're making to the government for the containment? Thank you.
Good morning, ladies and gentlemen. My name is Rabi Abdullah, and I head the health desk at the NTA. I would like to say that keeping Nigerians afloat with information like you're doing is quite commendable, as I know that the vibrant members of the estates of the 4-3M will do the needful subsequently. It's on that note that I would like to find out, sir, the fact that you were in Lagos on Saturday, and to brief us on if you got to see the patient, did you have access to him? We want to know how he's faring, because the survival of that Italian is going to tell a lot on the level of the nation's preparedness capacity. And subsequently, we've had reports emanating from the isolation hospital. Is it what it should be? Is the facility right? I know that place was put up during the outbreak of Ebola. Has there been any improvement on what existed then? And I equally want to find out, do you have some sort of synergy? Do you have collaboration with the response team that was put in place during the Ebola outbreak in 2014? Because this is about putting our best foot together to see what we can make out of this situation. You dispelled the on Saturday. I need more clarification. Did you get to see the taxi driver who conveyed the Italian from the airport to his destination? And what did you say to him? Nigerians really need information on that. Thank you.
The third question.
Yeah, good morning, Honorable Minister. My name is Femi Atoyebi from the Punch newspaper. My question has to do with the state of isolation centers across the nation, especially the one in Gwagwalada, Abuja here. The information we have is that the one designated for it is not ready, it's under construction, and the emergency and accident building that was to be used has not been equipped as well. The second question has to do with hand sanitizers, which is now almost off the shelf in almost of our pharmacy stores. People are talking about using alcohol to wash their hands. How effective is this, sir? Thank you.
The convention in medicine is that you do not disclose a patient's name to the public without his permission. If someone has a problem, you can talk about the problem, you don't talk about his name. If you talk about his name, you don't talk about the person. And this gentleman has not given permission, and I'm not sure if he has been asked, but he has not given permission for his name to be bandied around in the public. But again, there's also no need for anyone to want to know his name. He might want his own privacy. So the name is not a matter of public knowledge. As for the finances, yes, the government has provided the money that was asked for, and there's no financial problem at the moment, no financial need. The NCDC, which is the lead organization, the lead agency in responding to these all outbreaks of this nature, has begun the process of procurement to meet the needs that are arising due to this particular disease entry into the country, and also to fill the gaps of what it projects will be the need. Nobody knows how it is going to continue, so you cannot have a fixed figure about this is what you will spend or this is what it will cost. We only work on the way on how the situation develops. Now, the condition of the patient in Lagos is good. I was able to see him. He was strolling around in his room. I could see him from far away through the glass windows. And the information I have from the doctors who are particularly handling him is that his condition appears to be the mild one. Scientific evidence coming now is that not all corona infections run the same way. There are some that run without symptoms. There are some people who are infected and they don't show anything at all. You don't see. There are others who are infected and all you see is just a slight headache, slight cough, or a slight fever. And the others who fall desperately ill. So it is knowledge that is continuously being gathered, and the present assumption is that even the majority of people who have contracted coronavirus infection do not have symptoms or have only mild symptoms in such a way that they probably don't even diagnose it. So that is a blessing in that you have people that you do not treat. It's also a problem in that these people can be infectious, in that they don't know that they are sick, but they can be infectious. They can transmit to those who probably do not have immunity, and they themselves do not fall ill because they have immunity, and it's not easy to determine who has or who has no immunity. So those are all emerging facts about the coronavirus disease. Isolation is something that you do in two phases. There are those who are brought in who are suspected. You have not proven it, so you put them in one ward. And then after testing, if they turn out to be negative, you can discharge them or just give them a general treatment and they go. If they are positive, then you transfer them to the next ward, the ward 2, and that's where the real treatment takes place. You do not mix up these two. If you do, there's a risk that somebody who has something that looks like corona is put with somebody who really has the corona, and then you infect that poor person in that. So that's why you split the ward into two until you have your diagnosis. I hope that is clear to everybody. And it is because of that that you can have two separate kinds of wards for separating and disaggregating patients. Now, with regard to the NCDC position, when there is an outbreak like that, they send a rapid response team made up of people who are experts, epidemiologists, who are experts at tracking diseases and tracking people who have been in contact and identifying them and looking for them and giving them the necessary instructions. I didn't see the taxi driver, but he has been identified. He's under observation, and he's going to be monitored for the next 14 days, as all the 19 people in Lagos and 39 people in Ogun State who have been in contact with him, they're all being tracked and monitored. And they're all on self-isolation in their homes. The airline that brought him, the patient, the index patient, has been, of course, notified of the patient, and they have been advised to put their crew also on observation, the crew that came with them. The emergency unit, there's a brand new emergency unit, state-of-the-art, that is under construction, has been under construction in Gwagwalada, which was not yet completed, but they are working at feverish pace, and they should be completed by next month, April. In the meantime, we are using an ICU, which is just a brand new ICU there, which has been equipped. It has the furniture and has everything ready, but it also is also going to benefit from procurement that NCDC is making. As for sanitizers, yes, we do recommend alcohol-based sanitizers, usually a gel or any kind of formulation that is proven to destroy bacteria and destroy viruses and destroy germs and keep your hands safe. The airports, the equipment at the airport are very modern equipment. They are passive scanners in that you don't even know that your temperature has been taken. You walk past it, there's a special camera facing you, just like this is facing me now. You walk past it and it takes your temperature, and there's somebody observing a screen. And if you happen to have a high temperature, you see somebody step in front of you and invite you politely to come for secondary screening. Now, there are some people who walk past this camera without knowing that their temperature has been taken, so they complain that they were not even screened, their temperature was not taken, because they are used to the pistol type of scanner that is they point at your forehead to take your temperature. Some of you have seen that. It's still in use in some countries. In fact, when I went to South Africa the other day, that's what they were using. They point it at every passenger and to take your temperature. And so those who came from South Africa and experienced that came into Nigeria and complained that they were not doing it. In reality, you are being passively screened, and your temperature, if it is abnormal, will be picked up immediately. So that particularly for international arrivals. Any other equipment that we may need will be listed by NCDC and will be procured. I believe the question of the last speaker revolved around borders. Our putative expected, or rather a main suspected way of importation is by air. China is far away. We have no direct flight. Any flight coming here, we have to pass through different countries, and by the time they get here, some symptoms will show, others may not show. We think there's a slight risk of any person with corona coming by sea, but if you remember that the sea journey from China is about 3 weeks, and the incubation period for the corona is 2 weeks, so anybody coming by sea will have been seriously sick before they reach here. So, and they will immediately be discovered. And those who are coming by land, well, they will have had to go and land somewhere else outside Nigeria and then try and cross the border by land. Again, that will be a very difficult, unlikely proposition. But we are working with immigration, we are working with customs. On the 31st of January, we had a meeting with all the agencies here in which we all pledged to work together. Later today, we are having another follow-up meeting again, where all Nigerian agencies who are working at border control will work together to be on one page and help each other to observe patients, either visual observation or other kind of notification, to identify people who might be at a risk, both at land borders and at sea borders, and of course air borders. I think those are all the questions we've had so far. Yes, the mask, those who want to use masks, well, if you want to use a mask, very fine. But let me tell you that in Nigeria we have only one case, and that case is in Lagos. If you're in Sokoto and you feel like using a mask right now, or you are in Akwa Ibom, you want to use a mask, well, you are free to. But I personally am not very sure that maybe not because of this corona in Lagos, but if you really want to find, only that we do not see an absolute necessity for everybody to be putting on masks now. Okay. In China, it's different because it's invaded the whole city, the whole town, and they have had to put the town on lockdown. So it's different if you have one case or if the whole city is affected. The strategy will not be the same. So don't say, oh, in China everybody is wearing masks, therefore we must all wear masks here. The risk is not the same. The problem is not the same.
Okay.
Next questions.
Minister, I'm Onyebu Chiezi. I work with these newspapers. At one of the briefings we had here, you did say that the ministry and indeed government have ordered some stockpile of some of the the hand gloves and all that will be needed for case emergencies like this. I want to know, sir, the monies that have been approved so far, what amount has so far been used for this stockpiling? Has there been any deployed for stockpiling of this medical equipment? Yes. And also, the second question, you partially answered it. Just this morning, I was coming out and my children told me that their schools are telling them that they should come with face masks, and that if they don't come, they may not likely admit them in. You just said that it's not a necessity. So what is the government going to do to get this kind of panic measures being put around? What is the government going to do? Because school heads are the thing is catching on. Yes.
Honorable Minister, my name is Anule Emmanuel. I work for Agents France Press. Minister, I just want to get you straight on record in terms of figures. You earlier mentioned 19 contacts traced to the index case, and then again you went to mention 39 in Ogun. I want to specifically just nationwide, how many of these contacts are you tracing? And how many people are actually being supervised, not really quarantined? I want you to just specifically put these figures in context so that we get you correctly on figures. I appreciate it.
Good morning, everyone. My name is Ayada Malawushe, Premium Times. We hope the spread does not go more than what we have now. But yesterday, WHO was saying that all countries should get ventilators, so for ventilators to treat the patients. Now, knowing the situation of our hospitals and our healthcare centers, do we have, just in case, do we have enough that we would not have to start scrambling around if we have an epidemic? Thank you.
Well, let me start with that last question. All airports, particularly international airports, are security zones. And because they're security zones, you can't have people wandering around the place. Even if they're genuine journalists or even fake journalists, which you can have too. Now, as far as the equipment are concerned, yes, they are in place. I can confirm that. 8 days ago, I passed through those places. They were there. And even before, others have confirmed that they are there. I also have tweets from various Nigerians including senators who have praised the equipment in there and the alertness that is being displayed. And they have compared with other countries. So there are other countries that are not so alert as we are here. And there are, of course, again, as I said at the beginning, people who do not know that they are being scanned, that they are being treated, so they think nothing is being done. Because we are using remote sensors, we are using passive temperature gauges. So I assure you that these things are in place, and not only are they in place, we continuously monitor, check, cross-check. Even the form, the travel self-reporting form that they fill, we continue revising, updating, upgrading to fill in gaps that we observe. And to prevent people from filling the form and then sneaking by, we now give them a receipt. You have a part that you tear off and give them that they have to show to immigration before the immigration will even screen them and let them go. So those are all measures that we have put in to make sure that everybody gets screened, nobody will dodge it. Even those, though there are people who are in a hurry when they come out of the plane and they just want to get by, but even they will not be able to get by. Now, as far as manpower is concerned, yes, we have manpower. There's a standing manpower at all the airports. But we also have a call-up manpower. Those are the ones you call up when you have a surge, you want to bring in more personnel. We bring them from teaching hospitals, we bring them from various areas and give them some training, and so they are redeployed to where they are needed. And after the surge is over, they go back to our usual work. So we have a method by which we're able to increase staff from hospitals to meet the needs as the situation demands at every particular time. The collaboration between the government, federal government, and the state is excellent. We still have to build it up in certain areas. But the focus, I told you before, is in those states where we have international airports, Federal Capital Territory, Lagos, Enugu, Port Harcourt, and Kano. At the moment, Enugu is not functional, but it is included in the planning that we have on hand. I have visited Kano, and I have visited Lagos. Of course, we are all in Abuja, and I can tell you that they are working very hard to get themselves ready and prepare for the peculiarities of this particular outbreak. The corona is peculiar in its own ways, so you have to adjust to it. I still have to visit Port Harcourt, which will come up very soon, and then Enugu even before they start operating, to see their state of readiness there and assess their emergency operation center. So we have good relationship with those states, and if there is need for contact tracing to go further, we have the opportunity to speak to the governors, to meet them at governors' home, to brief them and talk to them, to always assist us in doing the work that we are supposed to do. Ventilators. The ventilators are standard equipment that are used in hospitals. When you are doing an operation, you normally use a ventilator for it. So the ventilator is going to use if the patient is not able to breathe on his own. And so you use a machine to do that for him or to assist. Now, only in the most extreme cases do you need ventilators. In those whose infection has badly affected the lungs. So we do have ventilators, and they will be deployed as needed when the case arises. But not all persons who have had a corona infection will require ventilators. The one we are seeing in Lagos now does not require ventilator at all. He's walking about, is okay. His own infection did not affect the lungs, and he's breathing very normally. So ventilators are for the very extreme situation. The question of stockpile, yes, the part of the reason why that amount of money was released was to go to create stockpile. Use the stockpile to service unexpected demands, and the particular commodities will depend on what emergency you are facing. So the NCDC is the one arranging the procurement according to the way they perceive the risks to be. So they make their request, put it on paper. The Ministry of Health, I go through it and look through it, and then if everything is okay, I approve it, and then send it over to where it's giving final approval, and immediately it's approved with no hesitation and not even one kobo is removed. So you get everything that you're looking for so that Nigeria can stay safe and Nigerians can be protected. With the face mask, I thought we had answered that already. No school should be demanding that children should bring face masks. That's not a requirement. That is not something that the government has advised. And the individual principals can wake up and then make demands that are not in line with general policy. So those who have serious illness, I can imagine that those who have serious illness, if somebody has cough and catarrh and has to do an exam, I can understand that such a person is given masks. They should actually be given masks. Anybody who has chronic cough or catarrh must see a doctor and stay home. But if, for example, they have to be at lessons, they have to be doing exams, then they should be supplied with or given masks for that purpose. But I do not see that it's necessary as a matter of routine for everybody in the school, and it should not be enforced at all. Now, the contact tracing, the 19 are the ones we have identified so far. Contact tracing is a specialized activity that is done by experts, epidemiologists who know exactly what questions to ask and how to track people down. And the purpose is to know, if you have an index case, who has he been in contact with, and what is the likelihood that that person he was in contact with contracted the disease from him. So, not only do you find the primary contact persons, you also find the secondary contact persons. That's to say, the person he contacted, those that one contacted too. So it's a wide range of investigation that is done by experts, and we have been able to identify 19 who are already under observation in Lagos, 39 in Ogun State, and continuing, counting. We cannot give a fixed figure because it's a continuous process. It's a work in progress. But the only one we know for sure are the number of people who were in the aircraft with him, 156. And those ones are being tracked, and we're talking to them and getting cooperation. There have been a few challenges in that some people gave telephone numbers that didn't work, or a number that was said to be switched off. There are some of them who probably don't have telephones, or some who are new arrivals in Nigeria. They are not yet registered with any phone company. They do not have a phone number. But there are ways in which they can be found out, because the manifest will release. Some have probably also left the country again if they are just here for a day or two. But the manifest gives you a document to start with. And it is that document that you begin to try and identify, even beyond what is required by WHO convention. The owner of the aircraft, the airline, they have been notified, and the embassy has been notified, and the embassy of the index case has also been notified, and the aircraft owner have been notified. So all the and then of course the World Health Organization has been notified. The international health regulations require that if you find something like that, you must notify World Health Organization. All those have been done. So we are in a clean slate as far as managing this is concerned. Now, let me say here that I am particularly proud of the response that has happened. We have been preparing since January when this news first came out, and asking questions, having meetings. We had a meeting on the 31st of January when we didn't even know that when or if the virus will reach this place. So by the time it appeared on the 25th, the response was excellent. Patient, he wasn't a patient at the time. He arrived here on the 25th. He went to a hotel in Ikeja. He spent the night there. That hotel has been found, all the contacts there have been interviewed and put on isolation. The room he stayed in has been decontaminated, has been fumigated, and even the taxi and that he went in also has been treated. And on the 26th, he started feeling unwell, and he reported to a hospital. I'm sure they tried to diagnose malaria, but immediately it was negative. They immediately had the index of suspicion to refer him, and he was referred to the infectious disease hospital. And there, they didn't waste time. That same night, they called me, and I said, it is very good that you do this test. They went to do that test, and that same night, by midnight, the result came out. So the whole thing took less than 48 hours. That is very fast and very commendable, and I'm particularly proud of the team. They worked like clockwork without delay. So in less than 48 hours from the 26th, in fact, barely 24 hours, we had our result. From the time the man complained to when we had our diagnosis, just over 24 hours, which I think is excellent. It's a very good test case. And this, if you look at it as a test run, we have done very well here. And I think that the team deserves a commendation for that.
No, you didn't say 156 passengers are still being traced. I want to know, sir, how many of these 156 are?
We do not know. We said 156 were on the plane. Yeah. And then some of them are being tracked. I cannot tell you exactly how many have been tracked. As I told you before, some may have gone back because some just came for a short period and left. In fact, this in this case was a consultant. He came for 2 days. He was supposed to have left the day before yesterday. So if not that this problem came up. Others have, but we're tracking those we can find using all the knowledge that epidemiologists have. So, but I cannot tell you the figures right now. We also can't tell you that. They are Nigerians, they are foreigners. We cannot give you the ratio. But we're looking at them as human beings, as individuals. We are not looking at the citizenship.
The very last question, sir, with your kind permission. With your kind permission, sir, I want to ask this question, and it revolves around our research and development capacity as a nation. We know that you had said that you've been in touch with China regarding the treatment protocol where COVID-19 is concerned. I'm asking this question just to know what we're already doing as a nation, or do we still go the lane of complacency where we just wait for other countries to hand down what they've been able to come up with? Are you in touch with NIPRID? What are we doing? Have we started talking to the researchers, the complementary medicine experts? What have we been doing? Have we made any headway, or we're waiting until they said diseases know no borders? Each country is rising to see what it can do. What is Nigeria doing in that regard? Thank you.
To answer that question, let me just quickly add that we have seen the Chinese ambassador 2 times, and he has given us assurance that they are taking care of all the Nigerians in China. In Wuhan itself, where this disease first appeared, there are about 60 Nigerians there. None of them has caught the coronavirus disease. They are all well. The only African who got it was from Cameroon, and he has been treated and is well. As of yesterday, I think the Chinese hospitals have treated nearly 42,000 of their own people and discharged them. 42,000. Out of about 70-something, 75,000, they treated and discharged 42,000. So it shows that it is treatable, and if they present early and follow the treatment protocol, and also they are learning too and sharing their knowledge with us here. The Nigerian ambassador in China, we have also been speaking with him. He is in touch with the Nigerian community over there and giving them all the moral support and also some financial support that they require The Chinese government also reassured us that they are supplying the Nigerians with food, with everything. So they don't need to go out to look for things to buy. They are supplied everything they need. So for those who have relatives there, we are assured that they are in safe hands now. Yes. And the relationship between the government of Nigeria and the government of China has not been strained by this development. And as far as research is concerned, we have an Institute of Medical Research, we know, in Lagos, Nigeria Institute for Medical Research, and they are interested in what is happening here. They are aware of other types of coronaviruses that have been in existence before. And as you all know, this one is said to be a novel virus, which means it's new. And all scientists are struggling hard to understand it, to understand its behavior. The sequencing has been done, that's the genetic sequencing has been done, so it's been shared. And the scientists are scrambling everywhere to find a vaccine for it. Somebody sent me a clip today about a research group in America that trying to fast track the development of vaccine. They think they will be ready by June. But I believe that even the Chinese themselves, where 95% of these cases have occurred, are doing a lot of research. Nigeria, we have only just one case, probably only just one set of this virus, which is all you can use for research. But Nigeria has been researching on similar viruses in the past, and the Director General of the Nigerian Institute of Medical Research and we have discussed it, and they are interested in doing this research and in pushing it forward. So we're not sitting by as spectators. We're trying to contribute to the body of knowledge available on viruses and on germs generally. I hope that answers your question.
Thank you very much, Honourable Minister, Minister of State, PMSEC, and our able directors. We have come to the end of the briefing. Gentlemen of the press, many thanks for coming. See you on Friday. Thank you.
Yes. I'm afraid that the attendance will not be good. I'm worried that the attendance will not be good. Okay. When we were there that evening, the secretary was saying she's going to scan it to the ministers. You know, we were there, he said he will scan the letter.
Yes. No, I think how far was that?
Did you ever scan the letter? Never scan the letter.
Sir, we shared it. The essay and your office were supposed to handle that for the ministers. And
they said they were going to scan the ministers.
Not for me, sir.
Maybe that was, I think that was sure.
Contact for the ministers.
In my section.